NBC 10 is learning new details about the first reported case of measles in Delaware. Hospitals and health officials are working to contain the possible spread.
NBC 10 Delaware reporter Tim Furlong has more on what you need to know about this highly contagious disease.
You have seen the measles rash, but the symptoms actually start a few days before that develops.
And what we call the 3 C's, cough, coryza, which is a fancy word for runny nose, and conjunctivitis, or itchy, watery eyes.
Dr. Marcy Dries is ChristianaCare's chief infection prevention officer, and she suspected Delaware would see measles after seeing outbreaks in other spots, including Pennsylvania. Measles is spread through coughs and sneezes, but unlike, say, COVID, it can remain in the air for up to a couple of hours.
They say that if 10 people who are not immune to measles go in and are exposed to a measles patient, 9 of them will get measles.
Measles has technically been eradicated in the U.S. since 2003, but Dr. Dries says vaccine skepticism, even including from some federal health officials, has led many people to not get themselves or their children vaccinated. Dr. Dries thinks that's a bad decision.
We've been using it for decades. It's extraordinarily safe. All the rumors about it causing autism or a number of other problems really have been proven false. So it is an extremely safe vaccine and highly effective. It's one of the most effective vaccines that we've seen.
Talk to your doctor for sure about this, but the guidance says kids should get the MMR vaccine around 12 to 15 months of age and then a second dose once they're 4 to 6 years old. But they say even as adults, it's safe to get a booster. The Delaware Division of Public Health says you're generally considered immune if you were born before 1957, if you have ever had measles, if a lab test confirms you are immune, or if you are sure you've received 2 doses of the MMR vaccine in your life. Delaware and every other state has a registry that should be able to let you know if you have been vaccinated. If you think you might have measles, Dr. Dries says first to call your doctor right away, or if you go to an urgent care or ER, call and let them know in advance that you're coming so they can prepare to keep you isolated. And, wear a mask to prevent your air droplets from infecting anyone else. In Newark, Tim Furlong, NBC 10 News.
The state of Pennsylvania launched a new way to track measles cases across the Commonwealth. There's a new dashboard up and running to let people know about cases and locations. It's updated every Monday, Wednesday, and Friday. Lancaster County is behind the state's largest outbreak.